Hi, this is Siddharth and I'm co-founder of IView Labs. We are an interactive information technology company and we have developed a software in the spree of healthcare that's Prapp. We call it as a patient registration app. This particular application is for the healthcare community. It's between the patients and the doctors. So what we are exactly doing is solving out a big problem of an engagement between the patients and the doctors. So what we have identified as a problem is that in the developing countries there is a very hard time for the patients to reach to the doctors, and this can be efficiently improved if we allow or provide a platform to communicate and mitigate the gap between the patients and doctors. So what does our software does? So we have a web interface for the doctors and an app interface for the patients. Also, there is an app interface to the doctors. The web interface serves as an admin for the reception's desk and for the healthcare professionals who are controlling the smart clinics. The application serves as an interface for the doctors and the patients. So there is an application interface on an Android and iOS to the patient and to the doctors. What we are doing is through them, we are making the patient call the doctors whenever there is a healthcare need. So say take an example, if a diabetic is suffering for some kind of a low level of sugar or high level of sugar, there is some increment or decrement or some kind of a sugar a mismanagement or some issue with their health inside their body. So what they're doing is that they can communicate using the app to the doctors. And also what they're going to do is that through that they can share across their history as EHR records and the health history and share it across to the doctors. So when they're coming to the clinics, onto the clinic side, they are basically publishing their health records using their profile ID and uploading their documents onto the particular cloud. And the same cloud where the documents are saved, they can retrieve it using the app onto their interface. Doctors can make the amendments, make the changes, they can recommend the prescription, they can recommend the health analysis about their data of their lab reports and etc. Stuff like that. So this is the kind of an engagement we are driving on between the doctors and the patients. For the same, we have much more plans to take this product further. And what these plans are like, we are soon going to also enable the patients with the IoT devices like weighing machine, for which the prototype we have already done it. So we are already taking a data using the weighing machine through Bluetooth low energy and mapping it across to the patient's profile. The same thing we are going to repeat it for the blood pressure, the temperature analysis and stuff like that. So many other health vitals and the parameters are going to be taken across onto the patient. Patient's profile, map it across to the patient's profile, and the same can be shared across to the doctors for the analysis. So this is in a nutshell what our product does, and for the same we are ready to participate in 4YFN event and many other events where we are showcasing our healthcare products, services. At this stage the product is having closely 10,000 patients and a couple of more doctors over here, and we are enabling the appointment booking and recording the EHR and uploading the documents onto the cloud. There are many possible ways to make revenue out of it. Currently, we are just testing the ecosystem, testing the market space, and just identifying what is the right way we solve the value and the problem, offer the value and solve the problem, and that's where we are trying to drive the engagement through our platform. Thank you again, and you can log on to www.iviewlabs.com for our corporate website, and our product website is www.prapp.in. And we do have an app, Prapp, as on an Android store and an iOS store. And you can also contact me anytime at info@iviewlabs.com. So let me know if you need any answers regarding any questions. Thank you so much.